So the question is, what sort of tips in general would we have for communication, just looking at horses, any sort of exam? And I work in what's called a referral practice, which is where horses come to me after they have seen other veterinarians. And if I look back at those communications, one of the things I think gets often missed the most is what's the actual expectation after the end of the exam or the treatment or things like that? And then how are we going to follow up to make sure that that expectation was met or wasn't met, so that the veterinarian who's first seeing the horse is clear to the trainer or the owner, okay, I'm going to do this injection or give this medication, and this is what should happen. And when it doesn't happen, someone circles back to that veterinarian to say, hey, we're not going in the direction that we thought we would, so that if the horse moves on to another veterinarian or another location, that person's not starting from scratch, or that an owner or a trainer isn't left thinking, well, that didn't work, and moves on to something new, when if maybe the veterinarian knew it didn't work, they might have a second thing to try. And that's because sometimes in veterinary medicine, we try a treatment or a medication to see how the horse responds to that. So that's a big communication sort of gap that I see, is after it's all kind of said and done for the day, what do we think is going to happen? And if that doesn't happen, how do we communicate that to each other? Even if it means you're not going to use that veterinarian again, it's just an idea of keeping a continuity for the horse and for the owner and for the trainer is, okay, we've done this exam, we set our goals ahead of time, we got through the exam, and what are we expecting to happen if it works? And if it doesn't, how do we communicate that back to each other? So that's a big sort of gap that I think people, if we could just address that afterwards, what happens, and follow up, I think that would help out a lot of horses and owners.